That's an area where most clinicians have a bit more expertise because these have been around for a longer period of time. But there are very common side effects we deal with, such as hypertension, hand-foot syndrome, mouth sores, GI upset, nausea, loose stools as well that can happen. And so there are, it's important to be aware of these symptoms. And I think one of the key differences with those versus immunotherapy is often we can actually continue treatment and perhaps reduce the dose of the drug, because these are oral pills most often, and they're dose adjustable. So if patients develop side effects, we can often reduce the dose, and these are more chronic side effects, but they can be the dose can be reduced to make them more tolerable. And then things like hypertension, we want to aggressively manage with antihypertensives, and if that's not sufficient, then we reduce dose. Things like GI upset, we can add supportive medications like loperamide to prevent loose stools, or anti-nausea meds to prevent nausea. And again, if neither of those solutions are working, we can reduce dose. And actually, in a high percentage of patients on tyrosine kinase inhibitors, the dose must be reduced. So we typically start high because we want to give patients the best chance, and often some patients can actually continue on the highest dose with manageable symptoms. But very often I tell patients, it's not a negative thing if we have to reduce the dose. We're really tailoring the dose to each patient, and we very often find that there's a dose that can be tolerated long term. And I have patients that are on lower doses that are still responding to tyrosine kinase inhibitor therapy. So I always say aggressive management of the dose is important with tyrosine kinase inhibitor therapy versus just kind of quitting the drug and without attempting these dose reductions early, or the patient has such pushing the side effects to a point where the patient just decides it's not worth it.